Hello friends, we are homeworkaustralia.com. We do Homework Australia assignment. Inflammatory bowel disease assignment help. Two major forms of non-specific inflammatory bowel disease are recognized: Crohn's disease, which can affect any part of the gastrointestinal tract, and ulcerative colitis, which affects only the large bowel. There is overlap between these two conditions in their clinical features, and histological and radiological abnormalities. In 10% of cases of colitis, a definitive diagnosis of either ulcerative colitis or Crohn's disease is not possible. Currently, it is necessary to distinguish between these two conditions because of certain differences in their management. However, it is possible that these conditions represent two aspects of the same disease. The incidence of Crohn's disease varies from country to country but is approximately 5-6 per 100,000 with a prevalence of 5-0-60 per 100,000. The incidence of ulcerative colitis is 5-10 per 100,000 per year with a prevalence of 80-120 per 100,000. Epidemiology and etiology. The etiology is unknown, but the racial differences and geographical clustering suggest both genetic and environmental causes. A cluster of patients with Crohn's disease has been found in a Cotswold village in England. Both conditions have a worldwide distribution but are more common in the Western world. The incidence is lower in the non-white races. Jews are more prone to inflammatory bowel disease than non-Jews. The Ashkenazi Jew have a higher risk than the Sephardic Jews. One familiar. Both conditions are more common amongst relatives of patients than in the general population. There is a higher rate of disease concordance in monozygotic twins. 2. Genetic. There are no HLA markers but HLA-B27 is increased in patients with inflammatory bowel disease and ankylosing spondylitis. 3. Smoking. Patients with Crohn's disease are more likely to be tobacco smokers, and there is an increased risk of ulcerative colitis amongst non-smokers or ex-smokers. Thanks for watching this video. Subscribe, like and share our videos.